Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I am here to answer some of your questions, especially around dog anesthesia, like when and why, and some of the questions that you might have. And I have an assistant who's going to ask me some of those questions.
Funny you should ask that. When would my dog need dog anesthesia?
So your dog is going to need general anesthesia usually when we're going to do something painful to it. For example, we're going to do a spay or a neuter. We're going to maybe do some dental cleaning and extractions. Maybe there is a reason for us to go into your dog's abdomen, for example, to take out a bladder stone or take out a foreign body, something they may have eaten. Maybe they have been hit by a car and need a fracture repair. Those would be some reasons we might put your dog under anesthesia.
What are the different types of dog anesthesia?
So there's really two main categories of dog anesthesia, one being injectable anesthesia and the other being gas anesthesia. Injectable anesthesia, we give an injection and your dog sort of becomes unconscious of its surroundings, but we don't have a very long period of time before that drug is metabolized and they come back out of anesthesia, so it's for a very short procedure. Gas anesthesia is when we're going to put a tube down their throats or intubate them. We're going to put them on gas anesthesia so we can control the depth and the length of time we're going to have that pet under anesthesia.
Are there any dog breeds that are more sensitive to anesthesia?
Yeah, so there are some different dog breeds that are a little bit more sensitive to anesthesia. We know that sight hounds, so that would be greyhounds, whippets, little Italian greyhounds, have some particular sensitivities to some specific drugs. So we're mindful of those breeds and what we can and maybe can't use. We have MDR1 gene mutation in our herding breed, so that would be our border collies and our Australian shepherds. Oftentimes we kind of already know that they're a predisposed breed to having some of those mutations, and we try to be careful not to use certain drugs in those at-risk breeds. We call it our smushy face breed, so that's our brachiocephalic breeds, which are our pugs and our Boston Terriers and our Frenchies and our bulldogs. They have more restricted airway, and so they're going to have more sensitivities to not being able to breathe as well during anesthesia. So there are several different breeds that we are mindful of what type of breed they are and what medications or drugs we may or may not want to use depending on that breed.
What do I need to know before my dog goes for an anesthetic procedure, like the exams and the evaluation, the blood work, and the fasting?
Yeah, so when your dog is going to go under general anesthesia, we often are going to partner with you on a kind of what you're going to do at home, when you're going to restrict food. Usually it's the night before. We're going to want your dog to take maybe some calming therapy at home before anesthesia so they come in more calm and relaxed. We're going to make sure that they're healthy, so we're going to do a cursory examination when they come in. We're going to look over their medical chart and see if they've had any blood work recently. For us, it's around in the last 6 months. We want to see if their organ function is good. Depending on the age of the pet, we are going to potentially do an ECG to see what their heart rhythm and their waveforms are before anesthesia. So there's a lot of things that we're going to do to partner with you to look to see what's the anesthetic risk that your pet has and what are the safeties that we have in place to make sure that we get through anesthesia safely.
What are the complications that could happen?
So general anesthesia is a true risk. So we're taking that conscious dog and we're putting them into unconsciousness. So we're immobilizing their muscles. We're changing their heart rates. Oftentimes we're reducing their heart rate. We're changing blood pressure and flow of blood through the body. We are impairing maybe kidney perfusion or blood flow to the kidneys. We're lowering that dog's body temperature oftentimes with the drugs and anesthesia. So oftentimes we also have we want to make sure their airway is open because we can have problems with airway. So again, there are a lot of risks that we have to mitigate for general anesthesia, and a good anesthesia doctor is going to be very foresightful in those risks and also ways that we make sure that your pet is safe.
after surgery, what do I need to watch for at home after my dog has undergone anesthesia?
So after your dog has undergone anesthesia, especially when they go home, because again, our patients aren't staying here overnight. We're going to allow them to go home because no one's here at night, so we want them to be home with you. Oftentimes, well, it depends on the time of day they go through anesthesia and surgery. When they go home, they might act like nothing really has happened and they're back to their normal selves really quickly. Others are older pets. They may have gone a little bit later in the day. They may just be able to barely get themselves on their feet and walk home to get in the car. Not going to walk home, but they're going to be able to maybe, get themselves back out into their car. When they get home, we're going to have you, make sure that they get safely out of the car, get into the house. If you have other pets, ideally we'd like them to be away. Give your dog a chance to get home, get reacclimated, get settled. Just be calm, let them be calm, find their favorite bed, and just basically be with them and supervise them is a way for you to know that they're going to be fine at home. And then we also are able to be contacted after hours at Blue Oasis. So we have an after hours Anapanion app, telehealth app. So if you get home and you're worried about your dog after general anesthesia, we're here to have you be able to ask us questions after hours. So if you have, there's lots of questions that people have regarding dog anesthesia, so we invite you to come in and ask all those questions before we proceed forward.